Hey there, everyone, and welcome to another episode of Stronger with Time. I'm your host, Tony Bataji. Our knowledge about health and fitness usually involves conversations about endurance, resistance training, and sports nutrition that are done individually. That makes it really hard to put all of those components together in a weekly program. I decided today to have a round table conversation with an expert in endurance, sports nutrition, and resistance training. Professor Paul Laursen is an expert in interval training and the world of endurance, and is the author of The Science and Application of High-Intensity Interval Training. Jake Doleschal is an expert in resistance training and program design, and is the host of the wonderful podcast, Hypertrophy Past and Present. Dr. Dana Liss is a world expert in sports nutrition, having worked with a number of world tour team cyclists and other professional athletes. This was a conversation where we could get three experts in individual subjects and ask them what goes into a good program for strength or endurance, how to eat for performance and recovery, and then all three could discuss how each of their individual components will affect the others and what goes into a good, well-rounded program to improve health and fitness. I loved bringing three experts together to have this roundtable discussion. I hope you take away as much as I did from this conversation. Without further delay, please enjoy my first roundtable conversation. Ladies and gentlemen, welcome to this roundtable discussion, which is the first I have done in this format. Well, firstly, a huge welcome.
Hey, Tony. Good to be here, man.
Yeah, thanks for having us.
Yeah,
Thank
thanks,
you.
everyone.
I wanted to have this discussion because when we think about advice to the fitness industry and people who are interested in their health and performance, it's often very siloed discussion. We would have a discussion with an endurance expert or a nutritionist or a strength expert, but very rarely do three people sit down together and talk about what goes into the well-balanced program and how each component, whether it's strength or endurance, can potentially interfere with each other. What we really want to know is how to do it and how to get the most out of it. And each of you three are subject experts in nutrition, strength training, and endurance. And I thought we would have a really great discussion on how to do this in the real world. So where should we start? I think we'll start first with the weight training and what goes into a good weight training program. And then we'll merge into nutrition and how to support all of the things with weight training, and then talk about endurance and improving VO2 max. And then we can get into a nice discussion on what we need to be aware of and all the components that make a good, well-rounded program. So Jake, expert in strength and resistance training, thanks for joining.
Absolute pleasure, Tony. I'm excited for this conversation. I'm nervous to be going first because I know I'm going to have questions for these other two presenters, and I think it's going to inform what I'm going to say. So I'm selfishly excited just to see how this conversation pans out.
Well, I'm always doing these podcasts for selfish reasons, to learn more from people like you. What goes into a good resistance training program? And I want to, for all of us, have a framework of somebody who's really time crunched, who might be able to lift weights twice a week, might be able to do cardio twice a week, but they really are the time poor individual. And then we're going to think about the individual who might have 45 minutes to an hour a day, a little bit each day to exercise. And then a third person who has really unlimited time and just wants to maximize their longevity and health. When we're thinking about a resistance training program, there's probably a minimum dose and then a dose on which you just aren't going to recover from, and therefore it's counterproductive. So let's talk about what goes into a weight training program from the variables, the sets, the reps, the exercises.
There's so much there. And to give an example of why I think this matters so much, I remember myself growing up and being involved in the gym. I used to get anxiety if I had to skip part of a workout. You know, if I had, 20 sets programmed for the day and I could only do 15, I think, oh man, was it the last 5 that mattered? Because there's this mentality, the last set's the most important set. And what's really cool in each of those examples you've just given there, whether you've only got half an hour, whether you've got as long as you want, is we know that there's a non-linear dose response for volume. So essentially what we see within a workout per muscle is each additional set produces less stimulus for hypertrophy. I'm talking from a body composition hypertrophy standpoint here. Cool thing with that is if you've only got time to do 1 set per muscle, that's actually giving you the bulk of the gains. Now, there's a caveat there, and that is if we do one set, or regardless of how many sets we do, what we want to do again is train that muscle when it's out of that stimulus period, but as close to it leaving that stimulus period as possible. So what I mean by that is we go to the gym, we create a hypertrophy stimulus. Now, everyone knows that muscle growth occurs outside of the gym, okay? And that muscle growth probably occurs over the next 2 days or so. And what we see is after that 2-day period, it starts to, and people get scared when I say this word, it starts to atrophy. That doesn't mean that it all disappears immediately, but we do start to see little bits of loss. And so much so that within a week, we are actually able to measure that loss. And so ideally, what we want to do is train that muscle again as close-ish to it leaving that stimulus as that period as possible, so we mitigate some of that losses. So what's cool here in a practical standpoint is if you were to imagine, okay, each additional set, less stimulating, we know that we start to see losses occur within a few days. If we wanted to cause net muscle growth and we only wanted to train a muscle once a week, the data tells us we'd probably need 4 sets or more on that 1 day per week. If we split up the volume, and we train that muscle even just twice a week, remembering that the stimulus period's only about 2 days. So twice a week, we've still got a significant amount of time outside of that stimulus period. We now only need 1 set twice a week, not even taking to failure. And that's going to cause net growth. So you can do half as much volume and get better results. So based on that, pulling that together, what that tells us is if you're poor on time, by far the best approach you could do is do these shorter full body sessions, just doing a single set, even per muscle. And if you do that 2 to 3 times per week, you're actually going to see good results. And the other point I want to make there is when people think about muscle growth, they think about like, if I'm only doing 2 sessions a week, and can I achieve sort of the physique I want? Is that going to put a limit on how much muscle I can obtain? And we know that hypertrophy is occurring within a muscle, but it's occurring within muscle fibers. And as long as we are training those muscle fibers and causing net growth across that week, eventually we're going to end up at that same position. So someone who's only able to train, say, twice a week, full body sessions, single set per muscle or 2 sets per muscle, give them a few years and they will end up in that same position as someone who's got an hour to do every other day, and they're able to do a little bit more volume, do 2, 3, 4 sets per muscle. That sort of ceiling for muscle growth is still going to be the same. The only thing that's going to differ is how long it might take you to get there. Does that make sense?
Mm-hmm.
Yeah, it makes a lot of sense. So there's 2 things I want to follow up on, and that is this nonlinear response with sets. And I think most people in the world of weight training perform 3 sets of everything because that's what has always been done. And with this nonlinear response, is 2 sets twice as good as 1 set, and is 3 sets 3 times as good as 1 set? Where does the dose response literature, what does it tell us?
Yeah. So we've got 2 good resources here, 2 meta-analyses and meta-regressions, and they do disagree a little bit, but what they both say is clearly each additional set provides less stimulus. And so that means that second set is not providing 100% of what the first set's providing, it's providing less. Now, the first meta-analysis, which I would say, based on the data it uses, potentially a better resource to use, that suggests, give or take, that each additional set is about half as stimulating as the set before it. So if you look at that second set, we can assume there's probably going to be about half as much stimulus as the first set, that third set about half as much as that second set. And so if we then follow that through, once we get to about 6 or 7 sets, we're kind of getting almost no stimulus. And in fact, if we look at how much volume, how many sets it takes to double the stimulus of that first set, it takes 6 sets in total, according to that first resource, to double that first set stimulus. So that second set is giving you decent stimulus, half as much as that first set. Like, that's pretty good, but is it as important as the first set? No, obviously not. And is that third set and fourth set as important? Obviously not again. So, I would look at that and say, hey, if you've got all the time in the world, and you know that you can recover, and I'm sure we'll touch on this later as well, sure, do 3 or 4 sets. That's okay. But if that's going to impact your recoverability, it's going to impact what else you can do, it's going to impact how many other muscles you can do in that session. The fact that we've got a non-linear dose response, so the fact that we know each additional set is less stimulating, tells us it's always going to be more effective to take that volume and split it up than to have it on 1 day. Like, there's no way around that. You cannot possibly suggest that putting all that volume, all those sets on 1 day is going to be more effective if we've got this non-linear dose response.
which is not typically done in our industry, which is a muscle group per day or two muscle groups. And there's the so-called bro split, where it could be chest and back and legs, or for a lot of the girls training these days, it's glutes on Monday, Wednesday, and Friday with astonishing training volumes. And if I understand you correctly, the subsequent sets are not as stimulating as the first set. Therefore, it might be better to do different exercises, given that one exercise can't target all the individual muscle fibers. Do you want to just speak to the idea that muscle growth is fiber specific, which means we need a variety of exercises?
Yeah. So if one were to look back in time and they look back to before, so when we see the introduction of anabolic steroids into the bodybuilding world, we have this sort of funny thing that happens where suddenly training just goes in all different directions and people will do all kinds of things and they're getting results kind of no matter what they do. And that very much muddies the water in terms of when we try to identify what worked, what didn't work, and kind of what might be the best for an individual, especially a non-enhanced individual. So if we go back a little bit further than that and we look at before sort of 1950s, what were people doing and getting good results? And, the people who are winning bodybuilding competitions and Mr. America and these kind of events, we see some funny things in the programming. And one thing that stands out is almost across the board, people tend to be using 12 or often more exercises in a single full body session. And there's a rhetoric that if you want to maybe have a priority muscle or bias a muscle, you can add additional sets. They don't say that you can't, but they would say maybe a better way to do that is actually add additional exercises for that muscle. And so you end up seeing some of these programs that'll be 15, 20 exercises all with a single set, and there might be 3 or 4 exercises for a given muscle. And to your point about muscle fiber specific hypertrophy, what we see is that growth is not occurring within a muscle as a whole. Growth is occurring within a muscle fiber. And so this gets a little bit complicated because what you can theoretically have within the same muscle is some fibers that are hypertrophying and some muscles that are atrophying. So you can have growth and loss within a given muscle. And all this comes down to which fibers are receiving a stimulus, a hypertrophy stimulus, aka mechanical tension, and which are not. And so to your point, what we can do, sorry, I'm losing my voice. What we can do is we can look at, instead of providing the same fibers with additional sets of volume, are there some fibers in that muscle that aren't active in that exercise we're doing? And can we therefore essentially give more fibers that first set stimulus? Now, what's interesting in basically every muscle at least every muscle we want to train in the gym, is we do have an activation deficit. So we're not able to use our glutes, our whatever, pecs, anything, and activate 100% of that muscle. So there's always going to be some motor units and therefore muscle fibers that are not getting a stimulus. So, if we look at the first Mr. Universe, he actually said, you know what, I would prefer to do 10 different exercises in one set than do one exercise, 10 sets. Now, I'm not suggesting someone go out and do 10 different exercises for a muscle. At a certain point, you're probably not going to be able to get exclusive or, different motor unit recruitment across that same muscle. But certainly, if we look at regional differences in activation, most muscles, we can easily select sort of maybe 2 to 4 different exercises that are going to have significant enough difference in recruitment that we're actually going to see different muscle fibers hypertrophying from those exercises.
So let's put that in practice, because you've mentioned so many things that we now are going to put into the weights room, and that is typically 2 sessions per week would be better than 1 session. And you've indicated then that 3 sessions, because you'll still be in that stimulus period or just coming out of it, would be better than 2 days. That 1 set gives you the majority of your benefit, which means that you're probably better doing different exercises for the same muscle as opposed to more and more sets in that same pattern. Let's talk about reps, recovery between sets, and then how you would structure that week for somebody training 3 days a week.
So there's a lot of, underlying assumptions people have about training and about the gym. And, most people will have heard, you need to perhaps do different repetition schemes to target different muscle fibers, and, slow twitch and fast twitch might need lower reps or higher reps. And And what we tend to see, and this is becoming a little bit more, I guess, accepted over the last few years, is there doesn't seem to be a significant difference in the type of hypertrophy stimulated by different repetitions. And ultimately, it's coming back to the same stimulus, which is mechanical tension. And we seem to have this sweet spot for this kind of hypertrophy, I guess, stimulus within the last few repetitions, 5, give or take, of a set taken to failure. So that is quite liberating in the sense that, okay, I can now do 5 repetitions. I can do 10. I can do 15. I can kind of do what I want and get a fairly similar stimulus. But there are some caveats to that and what you're alluding to. So we need to understand that essentially, if we look at a set of 20, and I've just suggested that probably the last 5 or so repetitions there are what's giving you the bulk, if not all, of that hypertrophy response. The first 15 repetitions, the job of those repetitions is to make those last 5 maximal effort. And so essentially it's almost like the way I would look at high repetitions in the context of hypertrophy is it's a way for us to essentially manage the load or use repetitions because we've only got lower load available, or we're choosing to use lower load, and those repetitions make that lower load max effort. Mm-hmm. And that's fine if someone enjoys high repetitions, or if someone doesn't have access to a lot of load. You know, again, if we use the example, the anecdotes of some of the old school bodybuilders, they often didn't have machines with heaps of load. You know, sometimes they would have, you know, they were doing calf exercises with people piling on their back, and they had to be doing 20, 30 repetitions. But nowadays, when you have access to all of this equipment, is there need to be doing 15, 20, 25, 30 repetitions? And once again, you can, but what we need to understand is that both within the session and in later sessions, doing high repetitions, especially to failure, does have an impact on our recoverability. Now, traditionally, people would think, oh, central nervous system fatigue, CNS fatigue, that's some heavy loads. You know, if I do a max single or something like that, that'll fry the nervous system and I won't be able to train again for a few days. What's super interesting here is if we look at, and there's not a lot of data on this, but the data we do have, if we look at very low repetition sets, so we're talking like singles, doubles, triples, you almost can't not recover from that. Like they get participants doing like 20 sets. And when I'm talking recoverability, what I'm talking there is your performance impacted in whenever we're measuring it, let's say in 24 hours time? And the way they're going to look at performance is usually going to be, they'll do like a proxy for voluntary activation. So are you able to activate the muscle fibers essentially? And if not, there's going to be some impact around central motor command that's stopping you from activating those fibers. Now, if we're doing low repetitions, like I said, up to 20 sets tends to be recoverable in 1 to 2 days. But when we look at high repetition sets, you know, stuff like 25, 30 repetitions, we see that that causes fatigue. So reduction in performance and activation for multiple days afterwards. And what's really interesting is you can actually look at, you have participants perform low repetitions in one exercise or one leg and the high repetitions in the other leg. And say you're doing a leg extension, and those who are performing high repetitions in one leg, the other leg that didn't get trained is fatigued for longer than if it just did low repetitions in that leg. So you can not train a leg and be more fatigued in that leg than actually training it with low repetitions. And we can talk about how that works if we want to, but what that tells us is, you know what, if we are wanting to train again when we sort of, you know, give or take this stimulus period within, say, 48, 72 hours, we do need to be a little bit conscious of those repetitions and sets as well. You know, there's a cumulative effect on recoverability from doing more sets. So in practice, what does it tell us? You can do 4, 3 repetitions if you want. You'll get slightly less stimulus from that, but you can do low repetitions. That's totally fine. It's not going to impact recoverability. But I would tend to keep that top end ideally down to that sort of 10 to 15 kind of range. And if you want to do a set of 15, maybe just do one set. If you're wanting to do multiple sets, ideally, I'd probably keep it to 10 or sub 10.
Okay. So what about then the rest between those sets? 30 seconds, 60 seconds, 3 minutes. Where's the current thinking on your ability to perform maximally again?
So we've got different fatigue types, and we don't need to get into those now, but essentially when we're looking at within a session, I guess 2 main types of fatigue that are going to take away from our hypertrophy stimulus are going to be spinal and supraspinal CNS fatigue. And all that means is the spinal fatigue is going to be exercise or muscle specific, And so if this is why, say, antagonist supersets work quite well, because you could do a chest set and then do a back set, and the spinal CNS fatigue is not going to affect the back set. And then after you've done back, you go back to chest, and then again, the spinal fatigue will have dissipated. And so spinal fatigue, again, that's basically just due to, think about it as the longest the set is that you do for that muscle, the more spinal CNS fatigue you'll accumulate. So if you do, say, an isometric where you're holding like a contraction nonstop for 30 seconds, it'll cause a decent amount of spinal CNS fatigue. If you do, a single set of, 1 or 2 repetitions, there's not going to be a lot of spinal fatigue from that. And when I say spinal, I'm not saying like your spine is fatigued. Okay, because sometimes I know people are talking about that online as well, deadlifting and axial loading and stuff. Essentially, we're talking about it, I guess, motor neuron excitability. Now, the other fatigue, which is probably a little bit more important to think about, I would say, again, because spinal fatigue does recover quite quickly, is what's called supraspinal CNS fatigue. And essentially, that's driven by any negative or discomforting sensation that we experience. Which is interesting because people often think, there's no pain, no gain. I want to, murder myself in the gym and train as hard as possible and as fatigued as possible and as sore as possible. And it's like, well, actually, that's fine, but it is contributing to this supraspinal CNS fatigue, which is actually going to cause reduction in your ability to activate motor units or muscle fibers. So anytime you have this negative sensation, whether that's huffing and puffing and burning in the muscle and, being out of breath and your heart rate elevating and all these things, it's taking up part of your ability, how much effort you can tolerate. It's taking away from that effort, essentially. So we've got a certain amount of effort we can allocate, and that's forcing us to allocate some of that effort to those negative sensations. And that means some of that effort can't be allocated to central motor command. So what we need to look at there is how much impact did the set before have on this supraspinal CNS fatigue sort of state? So if you're doing a set of biceps curls and you're doing maybe, a unilateral set and you're doing a set of 5, are you huffing and puffing after that? No. Are you, is your heart rate elevated? Probably not that much. And so yes, it will be spinal fatigue, but supraspinal fatigue from that is going to be very, very minimal. So you could theoretically get away with, if you're going to do, again, antagonist supersets, you could do one muscle, training a small amount of muscle mass in that one exercise, lower repetitions. You might only need 30 seconds, maybe 60 seconds before you go do the other body part. But if you do something like a set of squats, you do a set of 10 or 15 squats. For me, back extensions, if I do a set of 15 back extensions, oh my God, I'm huffing and puffing for 5 minutes. So honestly, within that 5-minute period, if I go do something else, it's going to negatively impact my ability to for max effort in that next movement. So I would say any exercise where you're using large amounts of muscle mass, and perhaps doing like high repetitions and you're huffing and you're puffing and you're out of breath after that set, really you probably want at least 2.5 minutes. And you can measure this yourself. Is your breathing back to normal? Most people are wearing some device that's measuring their heart rate nowadays. Those smaller exercises, hey, maybe 1.5 minutes is going to be okay. Maybe 2 minutes if you want to play it safe. But I would say generally speaking that 2.5 minute mark is going to be the ballpark for most people and most exercises.
If I were to summarize everything that you've just said in a sentence, and step in if I butcher this, when we think of resistance training for the non-athlete, we're thinking 2 days is better than 1 and 3 days is better than 2. So ideally 3 sessions in a week. To train all major muscle groups with typically a single set and an additional exercise if there's an area you want to focus and specialize on. Keep repetitions, generally speaking, under 10. And if you go above that, then maybe definitely only a single set. If it's a smaller muscle group, less puffing, cardiovascular system involved, maybe 90 seconds rest. And if it's larger muscle groups, more puffing, then typically 2.5 minutes.
Perfect. The only thing I would add to that is some muscles experience this unique problem where they're what are called 2 joint muscles, and a movement that's training part of that muscle, the other part of that muscle may actually be switched off completely. So a good example here would be the quads and rec fem. You do a squat, rec fem is not getting a stimulus. So the only caveat would be some muscles by default kind of need 2 different exercises. So one set of each would be fine. If you're wanting And this is important if you want maximal development in that muscle. Some people may not. A lot of my female clients don't want rec fem growth, so I don't give them a leg extension. But if someone wanted it, 2 joint muscles will be a bit unique.
Are there other examples other than that? So just to summarize, the quadriceps is made up of a knee only, but knee and hip with one of them. And it means that when you're doing a squat or a lunge or a step up, you're using the vasti, but you're not particularly using the rec fem because it crosses 2 joints, which means if you want maximal quad development, you'll need to do a multi-joint movement and a single joint movement as well. Are there other exercises in the body, deltoids, glutes, other areas of interest where that rule applies?
It can apply on a continuum as well. So there will be some where something might be switched off completely, like we just said with rec fem, and then there'll be some where maybe region of that muscle might have really poor leverage in a given exercise. And so it might get some stimulus, but very little. So for example, if you look at the triceps and we've got the long head and the triceps, again, the long head crosses the shoulder joint and where the other heads of the triceps don't. So if we've got any movement in the shoulder, we will see some reduction in long head involvement. Now, you can still get some stimulus depending on the exercise you're doing, but ideally what we would want would be, if we really wanted to target that long head, we could actually look at, well, where does that long head have best leverage, and we're not performing any movement of the shoulder joint. And so something like a typical triceps press down would be perfect for that. It does get a little bit, you can get granular with it if you want. Again, if we look at, say, the calves would be a good example here. So gastrocnemius crossing the knee joint. So what we see is the soleus will get a really good stimulus in even something like a squat. So there's actually a fair bit of foot movement that's happening in a squat. And so you actually do get some decent calf involvement. But because we're bending at the knee joint, the gastrocnemius is not going to get much stimulus there at all. So, but most people will naturally be using a stiff leg calf raise anyway without necessarily knowing that. So it's not necessarily something they need to be too concerned about. Again, if we're looking at regional differences, some of this will come down to the exercises we choose. It does get, I don't want to get too convoluted there, but, if we look at biceps, potentially depending on, again, on shoulder angle, we might actually see the biceps brachii drop out and the other elbow flexors sort of step in instead. So, if we look at, say, exercises where, what would be a good example there? Say something like a chin up. A chin up is a great exercise because it is a compound lift and you might have a beginner and they're able to develop so many muscles in that lift. But there's a good chance at the point where that exercise is hardest, the biceps brachii probably does get switched off. Again, biceps brachii crossing the shoulder joint. And then we might see the other elbow flexors step in that aren't going to be affected by shoulder position. So we'll get more brachioradialis, which is kind of that muscle in the gap of your elbow, and then brachialis, which is sitting below the biceps. So what I would encourage people, if they're interested in that, is think, what is my highest priority muscle or muscles? And then look at what are the regions of that. And again, most muscles you could generally say will have at least 2 different regions that we'll be able to bias. And then just look at, how do I bias those 2 different regions? Where do those regions have the best leverage? And if that's not important, like if it's a low priority muscle, you don't need to do that. But if it's a high priority, a little bit of time on Google and just find, hey, how do I selectively bias those regions?
Dana and Paul, how does that all land with you? And do you have any questions that you want to ask Jake?
You can go ahead, Paul.
Oh no, it's been fascinating listening to it. It makes me want to go and lift in my gym behind me. Right?
You're in a good setting for it. Yeah,
I'm definitely going to do that after this session because I'm shy of my 1 set at least for this. I really like that actually. And I actually try to do that in my own practice, my own personal practice, is because I have my own facility here. It's just so easy to go and just do that at a very minimum, like 1 set every 2 days or so, right? Like, so I get that minimum effective dose. It really, if you're creative, you don't even need to have a gym. Like there's lots of body weight exercises that you can kind of do as well that, to get that stimulus. The other thing I really liked in terms of where you started, Jake, and I hold the same philosophy around everything in terms of the training. It relates to, I stole it from Steven Seiler, but it's basically that maximal training adaptation equals regular molecular cell signaling, which you were kind of speaking about, plus autonomic balance. So that would be the only other thing is like context always, but it's like there's in all of these various different situations, you're working towards giving that signal. What it could be an endurance signal, it could be the strength signal that you're giving. It's always within the context also of the central nervous system in terms of how it's sort of feeling, which we were really alluding to with the recovery element and whatnot.
Mm.
But I think that's really important too, in terms of the autonomic balance of the individual that you might be able to get with heart rate variability or, wellness markers. And also, of course, neuromuscular fatigue. Really, that's probably where some of this velocity-based training is getting really interesting as well in the high performance sort of setting. So really, really great. Loved it.
When you started off saying you used to get anxiety around missing a set or a day training, I was like, oh, I used to be like that too. I had went 2 days in a row without climbing. I rock climbed full time for a while in my earlier years. If I went a couple days, I would I'd be almost crying. I could feel my arms atrophying. It was more psychological than anything. But what kind of resonated with me is, we like to get attached to these prescriptions of 3 sets, X, Y, and Z, or you have to do this for this. And you didn't give any sort of, you gave guidelines. And I think that's where, it's very similar in the nutrition space where we get attached to this is bad, this is good. You need 0.35 grams per kilogram body weight of protein in the first 28.5 minutes after your workout. And really in context, it's a lot more broad. There's a lot more options. There's a lot of other ways to achieve the same outcomes. And it really depends, again, on what your goals are. You don't always have to have protein right after. If you're just looking to kind of maintain muscle mass, have your meal later. So I'd like to see hearing sort of the wide variety of strategies that we can use in busy lives to maintain or build muscle and stay where we'd like to be.
Let's follow that discussion point directly after weight training. And let's have a discussion around what is good nutritional recommendations for those looking to build muscle. And let's do it in the context of building muscle, staying weight stable or increasing mass with muscle, or those people who want to lose fat and keep their muscle. I'm assuming that there's going to be a different emphasis when you have those different goals.
Absolutely. So in your first scenario where you're looking to gain lean mass or gain muscle, I mean, the easiest way and the sort of biggest component would be your energy balance, in terms of it's energetically expensive to make muscle. Your body needs extra energy, or will use extra energy to build more muscle. You're building more tissue. So having more energy available, so basically eating more calories is one of your biggest factors. It doesn't have to be like a massive amount, but a little bit of a surplus each day, depending on how fast you want to increase your lean mass and what your program is. But a little bit of a surplus will be the easiest way to increase your lean mass in terms of measurably and seeing that gain. In terms of dosing and total dose of protein for the day, there's definitely a broad range where people will, achieve kind of maximal lean mass gains. Sort of literature will go anywhere from between, 1.7 to 2.5 grams per kilogram body weight of protein. So what does that mean in food? The biggest factor, I think, with protein is more just getting your total protein goals for the day rather than having to time things every 3 to 4 hours. That's not necessarily something everybody needs to do. That's something we would do in the really your elite athletes. We really make sure we're maximizing every little bit of recovery and adaptation. So on the flip side, with somebody who wants to either maintain or lose body fat, but still maintain or gain lean mass, you can actually do that with a really high protein intake. And Stu Phillips is one of our sort of go-to protein metabolism researchers, and he ran a really cool study where males and females were the intervention group, so the group that was on a caloric deficit of 40%, within the errors that we have, and I think at least 1.7 grams per kilogram body weight of protein. That group, including females, were able to maintain and some gained lean mass alongside losing fat mass. And I can't remember the exact numbers, but the key there was they were in quite an energy deficit and protein intake was on the high range. And the training stimulus was enough, was the right stimulus to have your anabolic stimulus, which I think is something that even for a nutritionist, that's the biggest part, is your loading. Nutrition is like that little bit on the top that makes the difference, but the biggest part is your loading. So with both of those scenarios, I think the first piece is what kind of energy balance you have. So one is going to be a little bit energy excess, and the other, on the flip side, energy deficit. Both are going to be pretty high protein. You might have a little bit more focus on protein in the weight loss, just to make sure you're using every little bit of your protein, of your sort of the little bit of anabolic stimulant that protein and eating protein might give you. And then your timing might be a little bit different. So if I was trying to lose fat and maintain or gain muscle, I would probably maybe reduce my feeding window a little bit and use my regular meals as like pre and post training. Whereas in the lean mass gain, I would kind of add in extra snacks and meals around training to maximize that sort of your anabolism in that case, and not too worried about where I am with energy balance.
How does anyone know what energy balance is for them? We use these terms, create a 20% energy deficit or even slight surplus, but how does anyone in the public know whether they've got those numbers right?
Yeah, so you can go online and use calculators and stuff, but practically, I don't really like people like counting calories and getting obsessive. I find using like your hand and sort of plate visuals the most sort of universal way to change, your portions and your energy balance, and kind of having what your normal plate looks like. Let's say you have a 10-inch plate and you have quarter of your plate is starchy carbs, a half is, your colors, your antioxidant fruit and veg, and then a quarter is your lean or non-lean proteins if you are not vegan. And so just imagining a plate kind of like that. So, you would shift your portions a bit to increase the energy balance or decrease it. So around your meals, that's something that you can like start with your baseline. If you have a pretty good balanced plate and you kind of have a good grasp on, what that looks like for you, you can use your hand as your portion tool. But if you're looking to add more in, you could keep your plates the same, and then add in a couple extra snacks, and you would probably get extra 500 whatever calories. So from your baseline, adding in a couple extra snacks, maybe adding in extra nuts and seeds into a plate. So little things where you could increase the energy density of your food without having to sometimes I know some of my athletes have a hard time eating that much. You're just not that hungry. And on the flip side, shifting your plate a little bit so you have more of your watery vegetables, etc. So more fibers, more watery vegetables on your plate, and shifting down the carbohydrate, starchy carb, not too low though. You need starchy carb. You need to eat real starchy carbs. Don't do just veg and protein all the time. And your protein portion, making sure you have a portion that's at least the palm of your hand and the width of your baby finger is a good eyeball for chicken breast or fish a little bit, go on the air on the bigger side. So you can kind of get an idea of where your portions are at usually and how you might decrease. And you don't really always have to decrease your food volume. You can just decrease some of the density. So if instead of eating maybe you have a rice pilaf with vegetables, or I'll use a quinoa salad. If you had a quinoa salad with some vegetables, but mostly quinoas, you might just put more vegetables in that quinoa salad to just change up the energy density a little bit. So there's little kind of tricks you can do that you're not making massive changes. You're not on a diet. It's just working from where you're at and making those shifts to your portions or your food choices. And the other thing I find, and this is sort of more on John Hawley's work out of Australian Catholic University, is just the time restricted feeding. That's a tool that I'll sometimes use with athletes I wouldn't use it all the time, all year round. Just there's certain periods where I'm okay, we could try doing, this slightly smaller feeding window, because that's a good tool that works for them to achieve the results they want. So it's another little tool, just kind of keep your insulin, where your insulin's getting some carbohydrate love, and keeping that window a little smaller. So you're kind of increasing your fat burning for more hours during the day. It's not a magic anything. It's just a tool that works for some people. if they don't want to think about everything they're eating.
Do you see any gender differences when you are prescribing protein, timing of protein with respect to a training session, but also with the last point that you made, which is time-restricted eating? And I ask this question because there's a significant number of voices who would say the female physiology is different and therefore shouldn't time restrict their energy and should eat and graze all day long, but you should never exercise in a fasted state and then have time restriction. Just yesterday, I was sent another post by somebody saying that's the worst thing a female can do. And I always bristle when I hear the worst thing, regardless of whether it's a male or a female. You work with females, so what's your thoughts on this?
Yeah, I have yet to come across, a large body of evidence that shows these differences from a really good, robust study. Like, I haven't come across any of that evidence yet. I know there's a large group doing a lot of female athlete research right now. Dr. Kate Ackerman is sort of leading a lot of that space. But I haven't really come across any of that. I really look at an athlete more from, their athlete and all the factors that go into what are the physiology of their sport. What do I know about their genetics? And I think body composition and your natural sort of body composition also plays a role in the nutrition strategies that you prescribe to an athlete. So you might have like someone who's more mesomorphic, or you have an ectomorph or endomorph, and those sort of different body types respond a little bit differently to different nutrition strategies. So I think that's probably more of a factor, is more like the genetics of the athlete and the physiology of their sport. Of course, like the psychology piece. I have a really hard time having any sort of rule about nutrition or training applied across the board. There's so many nuances to the human body, whether you're female or male, that it's impossible to make any statements like that and it to be correct. It's just, there's so much variability. The human genome is expansive, and all of the environmental factors, and I just can't even, there's no way. There's just no way.
And Paul, would you agree, disagree with that statement as, again, somebody who's coached world-class, both male and female athletes, and uses different times of day of training with respect to meal timing to bring about different training outcomes? What's your thoughts as somebody who works in high performance?
Yeah. And I think it's really around like that training in that fasted window. Is that where it's potentially dangerous? Yeah, I mean, that's just weird. That's the ideal time for training for my athletes. So
And why is that? What's the difference between adaptation or performance being fasted versus fed?
Yeah, well, you got to remember that, your gut is an organ. And when you feed your gut, it requires blood flow. And that blood flow to do all the work of digestion and absorption is removed now from the blood flow that needs to go to the working skeletal bed. So just from that, it just kind of, you don't want that competition being set up. And this is why training in the fasted state is, it's excellent, because you can just divert all the blood flow to the working musculature for the aerobic system or the recovery from the anaerobic system. So that's, I mean, just from that, this makes a massive difference. When athletes come to me for help, that's usually one of the first key things that we do, is we actually shift that. We shift that away so that there is training that's occurring within the fasted state as opposed to the fed state. So for example, we just got off a velocity session this morning on Athletica, and we had 5 females in that session doing high intensity interval training all in the morning in the fasted state, just because it's, sometimes it's the last thing you want to do is actually feed when you wake up. You're in your fasted period as well, because you've gone to bed, you've had your dinner, and then you don't want to sabotage that and have this big insulin response that's going to blunt any of the fat oxidation that's going in there. This is a problem and relates to reducing your overall fat oxidation, and then therefore your ability to lose fat from your adipose bed, right? That's not what we want to be doing. So yeah, I'm really a big believer. I think it was said already, is to have, with Dana was saying this with John Hawley's idea about having these exercise windows and then having these feeding windows. And that's really what I believe in.
And do you ever experience, yeah, Dana, you go ahead.
Oh yeah, and I think just also understanding the context of the athlete. I think I've worked a lot in world tour cycling, and that's a very different context than what we're the sort of gym training we're talking about right now. But I think just as a female athlete, also just ensuring you're not putting yourself in a chronic low energy availability
Right.
situation too. It can get a little bit hard. You might still get your period. And as you get into your late these early 40s, you might actually still get a menstrual cycle and be in low energy availability. You have to kind of go a lot longer to get that signal that you're in that you
Yeah.
actually are really now in reds. So
Yeah.
just not going too far with some of the time restricted feeding or fasted. You're still getting your energy in. It's just when.
Yeah.
Right, exactly. And I think that's the concern, isn't it?
Yeah.
Yeah, and couldn't agree more. I mean, that is one of the key things when females come to me for the same issue. It's like
Mhm.
usually they present with the absence of a menstrual cycle or appearing
Mhm.
menstrual cycle, and the return of it is like that's hallelujah kind of thing, because then
Mhm.
the system's back in sync. Yeah, I mean HPA axis, HPA gonadal axis, and then you've got a reduction in the stress of the
Mhm.
individual,
Mhm.
and everything syncs back up as it
Yeah,
should.
there you go.
So yeah,
Response.
yeah, from energy to overall stress to providing the building blocks of a whole food diet that's
Mhm.
going to be facilitating, all of that stuff to make it happen.
So two follow-up questions would be, how close to that training session then, if it is in a fasted state, would you recommend that next feeding?
Yeah, I'd probably say, I mean, it really depends again on the scenario, but I'd say, within the next hour, if you've trained fasted, yeah, as soon as like next 30 an hour, it really depends on what the rest of your day looks like in the context. But I think that's a general, and it depends on what you're eating too, and how fast it sort of gets absorbed. But if you were in a fast and you're looking to maximize, I'd probably say as soon as possible, maybe max 2 hours after.
Yeah, Paul, and how do you see that world?
Yeah, same, just context, like Dana alluded to, right? Like, but but in general, again, I try to teach my athletes to develop their feel for everything, feel for training, but also feel for the need for nutrients. The need, we've got an apostat in the brain that's detecting hunger and signals and calorie needs and micronutrient needs. And when that you need to develop the ability to listen to that. What does your body really need? Does it need a dopamine hit of sugar? Probably not. It probably needs nutrients, right? Amino acids, fatty acids, micronutrients. These are the sort of the key things that it's asking for. And so what are the food sources that you're going to grab to source those? Unfortunately, the reality is I believe you need to educate yourself or find a good nutrition service provider that can help educate you in terms of the micronutrients that are going to come with various different food choices, and the ones that are going to be absent if you avoid that. So yeah, but yeah,
Follow-up
pretty soon after,
question.
listen to the brain.
Yeah. Follow-up question for those individuals who are training fasted. How long does it take to adapt if you've always trained fed? Because a common complaint will be, I don't feel so good, or I'm having a blood sugar drop. And I'm also interested, both Jake and Paul, in your view on then potentially mouth rinsing with carbohydrate if you have always trained fed, but now you're doing some fasted work. And where does that fit into the worldview?
Well, for
Yeah.
me,
Yeah.
again, context everything. So if
Yeah.
if you're feeling crappy before a workout, maybe you do need something
Yeah.
to pick yourself up to get through that workout, right? But then I would try to reach for a whole food source, right? Like, what if I had an apple beforehand? Is that good enough as opposed to a gel or a mouth rinse? I know the sports science studies, but it just doesn't sound very practical or for
Mhm.
me. Like, so, but if I don't, in the context where you need some food, some nutrients, then have that, and it's no big deal. That's great.
It's
Yeah.
not going to
And Jake,
destroy your training
No,
or your fat
yeah.
oxidation. Yeah, I totally agree with you in terms of feel. I'm somebody I really struggle doing any sort of fasted training. I'm a huge carbohydrate oxidizer. Um, and yeah, I don't have a set exact set protocol for what I eat or don't eat before training. It's, kind of how I'm feeling, or if I felt a certain way lately before training, I'd be like, oh yeah, I probably need to grab, an apple or a
Yeah.
shake or something.
Yeah. And Jake, how do you see the weight training world and intra-session nutrition?
Yeah, I mean, if we do look at the research on it, typically what we're seeing is that fasting, overnight fasting, I'm not talking extended fasting, doesn't seem to have much of an impact on performance. But we're looking at performance at baseline. What we do see is we can get an increase in performance if, and you mentioned carbohydrate mouth rinsing, essentially whether you consume the carbohydrate or not isn't of particular importance. So you could have something sweet. So let's say, a sports drink, or for me, I use what the old school bodybuilders use, which is orange juice mixed with honey. And then you could swish it and spit it, or you could swallow it. And that does seem to have an impact on, I mentioned supraspinal CNS fatigue earlier. It does seem to actually have a slight reduction in supraspinal CNS fatigue. So it's not that we're, replenishing glycogen or blood glucose or doing anything like that, but we're signaling, hey, there isn't going to be this sort of, shortage of energy availability here. We don't need to produce these protective fatigue mechanisms, which essentially is what fatigue is. It's just trying to protect us from, not getting into a dire state. So I have clients where if they train first thing in the morning, I'm not going to get them to eat a full meal. They're often going to feel pretty sluggish or pretty gross eating a full meal first thing in the morning and then training at 5 o'clock. But I will usually get them to have, my ideal would be something like a black coffee with maybe some honey in it. Or I don't know if any of you have ever done this, it's called the bumblebee. You have a shot of coffee in some orange juice. Tastes pretty amazing. And, maybe you mix a bit of honey into that as well, give it a go. And what I typically hear from clients is, oh my God, I'm training so much better. And maybe some of that's placebo, I don't know, but it seems anecdotally to make a fairly big impact on a lot of people.
If you've ever kind of felt hypoglycemic, you're like, getting like, a bit dizzy or really low, and you're like, oh, I cannot, like you have some carbohydrate within, I would say even seconds, you start feeling better. So we do have, it hasn't even gone down your esophagus yet. So the receptors in our mouth basically talk to the pleasure center of our brain, telling you, I've got some fuel on board. I'm doing good. I don't know the effects on lifting data in terms of performance enhancing or return back to baseline, but definitely an endurance sport. That's a technique we use in a fed and fasted state for a variety of reasons. One might be just to reduce GI issues.
Paul, any thoughts on that?
It's great. I think context is everything, right? I mean, you're talking here to kind of a keto athlete, right? Like I hang out at 1 millimoles BHB all the time, right? So it's no big deal. So it's I don't know, and I actually I don't feel great from the carb source.
Yeah.
In the morning, I just love training and I just feel good more kind of in the fasted state. High intensity, everything, no problem. But then I have a big feed after and I feel good. But I think there's 1,000 contexts that are out there, right? So I don't think there's a one size fits all for everyone.
And caffeine.
Let's turn our attention now, Paul, thanks Dana, to the discussion of improving VO2 max and improving cardiorespiratory fitness. Can you talk to us about the tools that we have at our disposal for the non-athlete to getting fitter, but also improving their cardiac fitness, which we know is so strongly associated with longevity? And let's talk about intensities and durations and different modes of training for the remainder of our time today.
Sure. So, I mean, we can go to Peter Attia's Outlive, who he did a great job of just making this relatively simple, but he highlighted, I forgot the actual study, but it was a key one that showed that, of all the various different all-cause mortality, right? Like you name them, diabetes, cardiovascular disease, dementia, all those things, like they were all like low odds ratio relative to the key one of not having high cardiovascular fitness. So if there's one thing he basically concludes in his book is like you want to have high cardiovascular fitness, right? So, okay, so how do we go and do that to lower our risk of the Grim Reaper kind of coming, which is, he's coming, but let's slow it down. So first of all, movement, right? Like what movement suits you? Like I mentioned before, there's 1,000 contexts that are out there, but movement creates aerobic development. So, and it could be for some of your listeners, Tony, it could be just getting out there and walking a little bit more and developing your zone 1 movement patterns and whatnot. But a lot of us don't have that time. So if you don't have that time, then maybe potentially some of this HIIT training that we're hearing about. And of course, if you've got lots of time, you can do the best of both worlds, where you've got the balance of the zone 2 training alongside with the HIIT training.
Let's pause there, Paul.
Sure.
Can you just describe these zones? And let's do that in the context of maximal heart rate, because there's a number of ways we can look at zones and percentages of lactate and VO2 max. But for the non-athlete who has a heart rate monitor, what are these zones that you're talking about?
Are you wanting percentages, Tony, or what do you like?
Why not? Let's just make this as somebody at home, they hear zone 1, zone 2, zone 4, zone 5. What, with all the confusion and debate around this, essentially, what are the heart rates? So what are they doing differently? So that people can understand, when you say zone 2, it's probably this percentage of maximal heart rate versus HIIT training, because then we can talk about balancing zone 2 with HIIT and then how to go about doing HIIT.
Yeah. Okay, good. So we talked a little bit about Stephen Seiler and his philosophy about the molecular cell signaling and whatnot. You want to be signaling sometimes the upper zones, right? Like Stephen Seiler is a sports scientist that developed the polarization theory that you want 80% of your training in the aerobic zone 2 or below, and you want 20% of your training high intensity, right? At least that's for endurance athletes. And of course, we let off with context. Context is everything. But zone 2 training is, in terms of a feel, it's like, use the talk test. Can I still talk in this, right? So we're talking like it feels like steady work, and you can definitely maintain a conversation. When you start to go out of breath a little bit, though, then you're moving sort of into this towards zone 3. And then if you're racing, you're into zone 4. But in the context of HIIT training, now you want to be definitely in zone 4 and above, right? You do want to be breathing really hard, because this is where you're recruiting the larger motor units that you want to maintain throughout your life. You're recruiting your heart to a whole new gear, because the ventricles of the heart are beating strong and fast, and again at levels that they haven't experienced before. So, and you mentioned max heart rate, so this is towards whatever your max heart rate is. The standard formula is 220 minus your age. Of course, there's lots of variation that's within there, but if you wondered, your listening might sit, that's kind of place to start. So those are the zones, Tony, and you can have a 5-zone model, a 7-zone model, like we do in Athletica.
And if we view, like we did with Jake, this person who's time poor, and give some context to that, time poor wants to maximize their health and fitness, what would be the minimum effective dose if you had 2 or 3 sessions a week to throw at your cardiovascular system? And what would those sessions generally look like?
Again, I keep saying it, but context. So I would try to do potentially either 1 or 2 of those as zone 2 and 1 hits, or 1 or 2 of those as HIIT and 1 of them is zone 2. Now, the key thing that zone 2 is excellent for is if you're stressed. So if you're a time poor individual and office work or whatever is super, super stressful, it's great to control that stress, usually with a zone 2 type session. Like, even we all know that going for a walk clears the head, right? So it's the same sort of thing. And then if you're under a massive amount of stress, and then you go into a HIIT session, you're adding actually more stress to that. So you got to be cautious a little bit. You could be adding more stress to the situation. Maybe on the other hand, it could feel really good to have that real hard hit out session too. So I'm sorry I keep going back to it, but I really do believe you need to develop your feel for what you need in any given context. And the more you have that and develop that feel, you have tools now at your disposal that you can use in any given moment. And but in general, if I'm time poor, it's like, 1 or 2 zone 2 and 1 or 2 HIIT sessions kind of in a week.
What does a zone 2 session from beginning to end look like? Warm up, main set, cool down. Let's assume you got 30, 40 minutes.
Yeah. So I do them all the time, but I get on my bike and I just start riding. And it usually start with a warm up of maybe 10 minutes, but I know where I'm going to kind of get to, where I'm going to be getting into that feel of steady riding. And it's a session that slowly builds by feel until you feel steady. It's like, you're ending at nose breathing, and you don't want to go too much farther past nose breathing, because then then you're moving into sort of the zone 3. And you can do that for 45 minutes and you'll feel amazing and you get back to the work.
And you've used, in terms of intensity, if somebody isn't that body aware and they're using nose breathing, a talk test, but if you're using a heart rate monitor, you've used numbers like 180 minus your age, or in your textbook, it's around 70 to 80% of maximal heart rate, if you know that. Is that still your thinking?
Yeah, that's a good place to start. I mentioned 220 minus your age for your max heart rate, and then you take 40 off that. It tends to be the first ventilatory threshold or your lactate thresholds. Yeah, 180 minus your age is a good spot where that heart rate could be around 140 beats per minute on the typical average person. So that's a good place for it to kind of be.
Let's now talk about HIIT, because I've learnt almost everything I know about interval training from you and your textbook. And as a personal trainer, not working with elite athletes, I've modified many of these athletic protocols to do what Jake has been talking about, and that is to minimize fatigue. In other words, I'm not trying to get the most out for a performance setting. I'm trying to make a signal to improve VO2 max and then go to the weights room the next day and do the best in the weights room, because this knock-on effect of fatigue is very real for the non-athlete who might be in energy deficit. And these are all the things that we're trying to play with. But you're a real expert on interval training. Can you just talk us through the long intervals, the short intervals, and for the non-athlete, how long should you be doing this for just to get that signal, but without draining the system, given that you've got to go back to work, got to lift weights the next day, you probably won't get enough sleep with your kids, and you understand that's the context that we're now going to jump into.
Yeah, so if you look at the classic studies that Martin Gabala and others have done on HIIT training, they're doing these what are called sprint interval training sessions, where there tends to be like 30 seconds all out, and with maybe 4 minutes in between, and then do that again, which is great, and they've shown great results in a time efficient sequence. Again, you just have to, and that might suit your context where you only have a very short window, and that's great. But that's quite stressful, and I would just there's not everyone's going to enjoy that. The long interval or the VO, is similar, where this is like at a power output that's close to your VO2 max. So you're breathing really hard, and it's sitting between 2 and 5 minutes generally, and with about 2 minutes recovery between, and however many of those you could handle. Once again, quite stressful. We label these as type 3, 4 in our physiology sequencing type format. But the one that I really like is the short interval, and the short interval is exactly as you would expect, where they're anywhere from 10 seconds to 60 seconds of work, a little bit higher than that VO2 max power, but with repeated short rests as well. It's a 30-30 sequence, for example, is a really good one. And this keeps the lactate, the sympathetic response, at bay. And it allows for you to, you slowly get up to VO2 max in that session, but your lactate is usually a little bit lower. And so you might do, say, for example, 6 repetitions of 30 seconds with 30 seconds in between, and then take a pause, and then do another sequence like that. And in that context, you're stimulating your fast twitch muscle fibers that are, say, in your legs in running, rowing, or cycling. You are also getting the cardiovascular stimulus that I mentioned as well, where you're going towards maximal stroke volume, maximal cardiac output, maximal VO2, and it's very time efficient too. You can do that in 30 minutes or less, and it's not it doesn't kill the sympathetic system. So remember, again, I mentioned training adaptation equals, molecular cell signaling plus autonomic balance. It keeps the autonomic balance, the central nervous system fatigue that Jake was speaking about, at bay. And that's really the beauty of the short interval sequence.
I've found that to be true all the time when you compare traditional interval protocols, whether they're sprinting or whether they're the so-called Norwegian 4x4 or any of those longer intervals. The ability to recover and then get into the weights room the next day is so greatly impaired compared to doing these short interval protocols for the reasons you spoke about: autonomic fatigue, lower lactate levels. Jake, how does that land with you in terms of fatigue and what Paul is talking about?
So just to clarify there, Paul, so those 30-30 intervals you're talking about, what's the intensity of that work period? Are you building over that time?
It could, but they tend to be like when we do them on Velocity Athletica, we do them around in what we call our zone 6. So it's basically about 120% of your VO2 max.
So
this would be a fairly max effort then?
Yeah, pretty. Yeah, but only for 30 seconds, right? And the key thing, this is why they're so beautiful, is like that short window, that 30-second window, done passively. In other words, you're hardly moving the muscles at all. It allows for a resaturation of the muscle bed with, due to the myoglobin principle that's in there, the hemoglobin of the muscle, and it keeps the overall lactate at bay. And that's the key. That's the key little trick.
So
that
compared
we learned.
to the earlier interval you talked about, where say maybe you were still doing a 30-second work period, but then say you had 4 minutes off, you had a long rest period. So in that time, I'm assuming more lactate is dissipating. So in only this 30-second rest period, is that sort of keeping enough fatigue, if you will, that it requires? Like, what's the difference, I guess, between those two scenarios?
Yeah, about more like 170% on the sprint interval.
Okay, so the
30 second. I mean, it's amazing how much power you can actually produce, right, over VO2 max, right? Like you're producing big watts, right, in those all out, because like a sprint interval training is all out maximal. So it's like, and this is just every single muscle fiber that you have for 30 seconds. Like you've done a Wingate's test, I assume, probably from your sports science, right? Think of how you feel after a Wingate test, right? Like there's people puking all over the lab in my experience when I was teaching and stuff. That's not the case for these short intervals. These are maintainable, sustainable efforts. But they're still good quality. And so you just get the best of both worlds when you nail these.
Obviously, physiologically, there's some differences here, but what's interesting to me is how that sounds in theory to parallel to something like clusters in the gym. And if you're to look at how, clusters perform, the way, I would typically perform them would be, say, you pick something like a 5 repetition max, which we know is going to have generally about maximal voluntary activation, and you perform a single repetition with it. And then you take this little intraset period where, maybe you take 30 seconds or however long it might be, and then you do another single. And the idea with that is you're letting some fatigue dissipate, some of the supraspinal and spinal fatigue dissipate, but we're accruing some metabolites. And the metabolites is the kind of fatigue we're not worried about in the gym. It's a fatigue. It's not going to be beneficial per se, but it's not taking away from our ability to create a stimulus. And it's interesting that what you're explaining there, obviously we've got some different mechanisms, but it sounds similar in a sense where you're not doing this total max effort, but you're still doing a high effort. And you've got this reduced rest period where some fatigue mechanisms are dissipating, some perhaps aren't, and perhaps some that allow you to, still continue to get this stimulus in those repeated bouts. So it's just interesting, like, oh, okay, this is an application that goes across multiple industries where we have this little rest period allowing some fatigue to dissipate, but maybe we can use some fatigue to our advantage. So it resonates with me, I guess, for a different reason. But Tony, I forget what your question was even. I was just interested in asking Paul that.
Well, funnily enough, Jake and I had dinner last night, and I said a lot of what I do is informed by cross-discipline and what endurance athletes are doing and what you're doing, Paul, with these micro intervals, that I take those ideas because they work so well for the cardiovascular system and I apply them to the weights room, hence with cluster sets. And these are bread and butter methods, but they're really based on the same idea that you're using with short intervals.
Yeah, for sure. But again, yeah, I think Jake is on the same sort of, yeah, and yourself are on the same pathway here with, and again, I keep going back to it, but training adaptation equals maximal molecular cell signaling. How, like, you're trying to kind of think about different tricks to maximize the molecular cell signaling without putting the autonomic balance out of kilter. Now, again, back to the original question on the sprint interval training, like the autonomic balance just goes out of whack when you're 170% and you're screaming, you're all out for that 30 seconds. And you're just getting that one stimulus and you can't do any more or that many. But if you just dial it down a little bit and then have that recovery, it's like ping, 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 and you're telling those muscles, no, we need to adapt, right? And David Bishop has actually produced this a really cool latest review where he basically he's stating that the type 2A fibers, those are the intermediate fibers, they can be, if they're stimulated correctly across all of these exercise modes that we're talking about, they can become as fatigue resistant as your type 1 fibers. So then now you've got the pretty powerful muscle fiber, but it's got all that the mitochondria that are around it that are buffering all of the any fatigue mechanisms or byproducts that are going to cause the central nervous system to fatigue and downregulate. So pretty cool.
Very cool. Paul, two final questions. You've mentioned 30-30 intervals may be done for 6 minutes. Is there a difference between constructing the work to rest ratio? So that's a 1-to-1, but what would be the difference if you did 40 seconds of work and 20 seconds recovery, or around the other way, 20 on and 40 off? Do they all do the same thing, or should we stick to a 1-to-1 ratio?
Such a good question, because we did those this morning, and MJ is our lead in Athletica for she decides what we're going to do on any given day. And I was so pissed off because we did 40-20s this morning on the intervals, and they kill me, and I'm not good at them. And so it really, like, it binned me. I'm not conditioned well enough right now. So what it does is it's duration on top of intensity is going to make it more of a glycolytic process, right? Like it's just, and lactate appears and then the sympathetic system rises and it's way more stressful. Conversely, to your question, 20 seconds on and 40 seconds off. Now we've increased the restoration even more. So even more time for the myoglobin to resaturate and for the whole exercise to be lower in terms of its lactate response and therefore its sympathetic response. So your autonomic balance in the 20-40 is much better than in the 40-20. So yeah, be careful on what you're moving there. The levers,
right?
Bigger. If you want less lactate, then you want more recovery, and you want less duration of work bout.
Super interesting. Finally, how does one warm up for a good HIIT session? We've got warm-ups we do in the weights room, but how are you, if you were doing that 30-30 or 20-40, do you just jump straight to that first one, or is it incremental? What's a good warm-up?
Yeah. I mean, 10 minutes easy, and then 10 seconds at target pace, target power, followed by maybe a minute, or like just on the minute kind of thing, right? Just 10 seconds, 10 seconds, 10 seconds, and you're pretty much ready to go through the process of autoregulation, and you're basically the capillary beds that are around those larger muscle fibers, they open up, and when you hit the first one, it's not too bad. But I will say you'll still feel the warm-up effect. The session I did today, it was set 2 that I felt best on, and that's just an indicative of the fact that you're still warming up even through that first set of exercise. So,
and how many sets would you do if it's, say, 6 lots of 20-40 or 30-30? Would you do 2 of them, 3 of them? How long in between?
Yeah, it really depends on the person. And again, you will, like, it's like if you are just starting out, I would do 1. And then the next week I'd come back and I'd do 2. And then the next week I would do 3. And on it goes, right? So some of my, my top endurance athletes we're doing sets of 6 and reps of 8 to 12. So it's like you build on them.
And Jake, how do you see a warm up for a weight training session?
I mean, to be honest, Paul's warm-up doesn't sound bad. Not really anyone would do it, but it'd be effective. Like ultimately what would be great in a weight session is to actually physically warm up the temperature of the muscles that we're going to use in that session. Now, that's not going to be achieved just by doing a couple of light sets with the exercise one's going to do, and which is why I say Paul's warm-up would be better really than what most people are doing. But if someone's not wanting to spend 10 minutes on a exercise bike or even potentially sitting in a sauna or something to warm up a little bit, then what I would suggest is a first set of the exercise you're planning on doing, and doing that really light and doing, 5 to 10 repetitions. And basically this is just, does my body work today? Is this exercise feeling okay? Does anything hurt? Have I set it up properly? We're not doing anything magic. We're just proof of concept. Everything's working okay. Then I would normally do one more set where we might go, say, half of what our working weight is going to be. And again, we don't want to do excessive repetitions, 10, 20, 30 reps and warm-ups. That all you're doing is creating some fatigue. Like that's actually going to subtract from your working set. So we might do 5, 6, 7 repetitions with half your working weight. Again, should be fairly easy. We're not trying to get anything, sort of too exhausting out of this. And then for a lot of people, that's probably all you need. And what I would suggest is if that's all you're doing, that one sort of, 50% of your working weight set, try to do that with max velocity. So be as fast, as explosive as you can in the concentric. And what that's going to do is that high effort. It's not going to be hard in the sense that you're going to failure, but it's going to be a high effort that you're going to use as many muscle fibers and motor units as possible in that movement. We get this sort of, it's called a PAP effect, potentiation effect, where when you use these muscle fibers, it kind of positions the contractile proteins in the muscle fiber better for that working set. So if you do a high velocity set, then you take your, say, minute off before you do your working set, that working set is going to perform better. Is that going to be a higher or bigger hypertrophy stimulus? We're not so sure, potentially not, but you will perform better at least. Now, if someone needed more warm-up sets, they totally could. They could do a third set on top of that. And if they were to do that, what I would say is pick maybe 90% of your working weight and just do a couple of repetitions with it. Some people will feel better doing that, but honestly, the warm-up set is more than anything, the way we perform it is A, to achieve that potentiation effect I mentioned, and B, it's a psychological thing. And you're just making sure it feels good, you feel coordinated, and you're good to go. If someone said to me, I don't need any warm-up sets, I'm good to go, I'm not concerned by that. They can do that if they feel good doing that.
I see the world the same way. And one addition is the older clients get, then we tend to do more warm-up sets, and their joints love them for that. We're going to wrap up just with a few one-sentence answers from the questions that we've had. So this is across different topics, but they are pretty context-driven. And I'm just going to start in no particular order. We have a 60-year-old who is at the point that they can't increasing the weight or the reps. How do they still challenge their muscle and bone? Jake, this would be in your wheelhouse.
Mm-hmm. So what I would do is, as someone gets older, let's say above 60, that's probably the benchmark there, they may benefit, instead of that third session I was talking about before, maybe just reducing down to 2 sessions. So I would reduce down to 2 and see if you are then able to actually progressively overload or add weight to the bar. The last bit, I know this is another sentence, is see if you can get micro plates. If your gym only has, 2.5 kilo plates or whatever it is, go on Amazon or eBay, buy 0.5 kilo plates or even 0.25 kilo plates, and just use really light plates to add to it.
Great. Question 2, how to improve digestion? That seems to be the limiting factor when somebody is exercising and potentially in energy deficit. I think you both probably have a perspective on this.
How to improve digestion?
Who's going to go first?
Any ideas, Paul? I'm happy for you to go first.
I don't really understand the question. One more time.
Well, I interpret the question to be that when somebody is exercising a lot or potentially not eating enough, they might have gastrointestinal disturbances. And I see that all the time in physique, competitors that are fine in the off season, but then in the dieting phase and the over-exercising phase, their digestive system goes haywire and they get irritable bowel syndrome, and then they get constipation, and then they get bloating, and then on and on. And I use scenarios like you mentioned, exercising in the fasted state, to get that exercise session with nothing in the GI tract. That's one perspective. Jake, I know you would probably have some thoughts on this as well.
Yeah, so from my perspective, probably what they're doing in the gym, provided it sort of looks similar to the stuff I've talked about, not going excessively high in volume and repetitions, doing longer rest periods, I would imagine that that shouldn't be a big exacerbator. I would think maybe more the cardiovascular sessions they might be doing would be a bigger issue for them. And from my perspective there, if we look at some of the literature around like exercise-induced intestinal permeability, we do tend to see a correlation with both intensity and duration, and also potentially heat that one is performing the exercise in. So for my clients who do have GI issues, if they are doing aerobic work, I would typically limit that to sort of half an hour sessions, and I wouldn't go excessive in the intensity. And the type of intensity you were talking about, Paul, like that 70%, like that would resonate with what I would do with those clients. And then the other point I would make there as well is, and this would be more of a Dana question, but obviously diet's going to be really important. And if someone is getting these issues in, you say they're a physique competitor and they're going to get in C's in a part of their comp prep, I would be looking at, well, what foods are you eating now that you weren't eating in your off season? And odds are people are opting for higher volume foods just to feel more satiated. And a lot of those high volume foods, maybe they're either, much higher in fiber than they used to, and that could be causing some gaseous issues and, more hydrogen methane. Or maybe they're using, food to have more artificial sweeteners and low calorie options, which again could be exacerbating or causing some of these issues.
Yeah.
Paul, any input there?
No, I would just say the only other one kind of alluded to at the end, but by Jake, is the just check the diet. Like it's possibly something that isn't, it doesn't sit right with you. Whether it's gluten is a common one, lactose is a common one, and just check your volumes of those, and potentially do a bit of a elimination to see if that makes any difference.
Jake, is there any difference in a resistance training program for somebody whose goal is fat loss? And then, Paul, is there any different approach you use for the cardio, whether you do more zone 2 or more HIIT for somebody who wants that energy expenditure component? Jake?
From a fat loss perspective, our biggest goal is to maintain muscle. And so what we know is that atrophy rates do seem to increase a little bit when someone is in a deficit. And therefore, it becomes even more important to train that muscle again, provide a stimulus as close to leaving that stimulus period as possible. What's interesting there is the things that become more important in fat loss are the same things that are important in a normal muscle gaining phase. So actually, if we were to say, how do we make the best fat loss training phase, take that and then just do that all the time. Because if it's best for fat loss, it's going to be best for muscle gain. So really nothing should particularly change.
Yeah, I see it the same way. Paul, and this is where I think we balance the stress of the session, because our industry is, if you're training for fat loss, you'll do intervals every session because it has a higher energy expenditure and it's harder and harder is better. And I think you've been suggesting the whole way through, it's this balancing of stress and the signal of the exercise session. If your clients say, I need to improve body composition, what's your thought process around high versus lower intensity?
Yeah. Well, again, body composition, I'm biased to think that it's more diet induced, with the primary hormone insulin as the key regulator. So I think that's generally that's central to usually the problem of getting rid of fat out of the adipose beds. But with respect to zone 2 training, it's excellent for that. I mean, with the exception of HIIT training, where you can actually have a big bolus of catecholamines like cortisol that actually spill out more glucose. But usually in the case of fat loss, it's like doing more work. We see it all the time in my endurance athletes, right? When they start on a training program and they start doing more work, they inevitably lose fat mass. They become more lean. So if you're in the endurance context, consider putting a race on the calendar in the future, and then finding the time to work towards that. Again, balance the training along with zone 2 plus HIIT.
And would you use that Seiler model of primarily zone 2 sprinkled in with HIIT, or
Yep.
do you have a different thought in this population group?
No, I think that's really that's ideal. How lots of different ways to skin it, of course, but in general, if you're training for an endurance event, it's a duration-based event. So a balance of those is a good road to Rome, right? The zone 2 is really preparing you for the duration that you're about to tackle, but then the HIIT training is kind of lifting the whole system up there, so you can do that at a greater rate.
Yeah, it's remarkable that this industry tries to pit one against the other, whereas every coach talks about using them in different contexts and different amounts rather than one versus the other. The final question for both of you is, what considerations do you have for people north of 55 years in terms of the variables and the frequency, the intensity? What considerations do you make when you're working with older individuals?
So from my perspective, again, not much should particularly change. When we start talking older, so again, I'd be thinking 60, 65, even higher than that. That's where I'm going to be maybe a little bit more conscious with recovery. And so that's where potentially those 2 sessions per week might be more suitable than adding in that 3rd session. But generally speaking, the main difference we're going to see with older individuals is there's a higher likelihood, obviously not all the time, but a higher likelihood that perhaps they have been inactive, and maybe if they're getting into the gym at an older age, there will obviously be differences in, say, if we look at say fast twitch muscle fibers, obviously they won't have been as hypertrophied. So my goal with those individuals, if they are new to the gym, is doing things that allow them to gain access to those motor units they wouldn't have gained access to previously. So this is where I would prefer to do heavier loading. I would prefer to do those longer respirations, stuff we've talked about anyway, but it's going to become more important so they can access more motor units and hypertrophy more muscle fibers. Still, volume is not going to change. 1 to 2 sets, maybe a 3rd set sort of on the top end. But yeah, if someone doesn't seem to be progressing after several weeks, I would just drop down to that 2 times per week.
And Paul?
Yeah, in the endurance context, well, again, I'm in that age bracket that you just mentioned, so nothing changes too much, but context is everything, right? So if you are slowing down, then you got to drop the volume a little bit, and that's in both the overall weekly volume of the whole program, and certainly the HIIT stuff as well. But it's amazing what older athletes and older masters athletes can still do right into their later years. So that's why context is so key. There's some 70-year-olds that are still hitting it out of the park, but it could be equally a 30-year-old might need something that's really really slow and low volume just to begin with to get them moving if they're sort of in the couch to 5K range. So context always.
Yeah, that's the resounding message from everyone here today. And that is blanket statements on you should do this if you want hypertrophy or endurance or because you're a female, whereas it is individual and it is context, and pay attention to your performance, your recovery, and become more intuitive with how your body is feeling at different intensity zones. Guys, thank you so much for your expertise and sharing how you view the world of exercise. Paul, where can people find you? And then Jake, where can people find you?
Yep. You can find me at athletica.ai, which is our AI coaching technology. And if you're a coach out there, check us out on hitscience.com, where we teach the science and application of high intensity interval training.
Fantastic. Jake?
And for me, I have my own podcast. So that's called Hypertrophy Past and Present, where we do talk a lot about sort of old school bodybuilding, pre-steroid era bodybuilding, and muscle physiology. So that's probably the best place to find some of my content. Otherwise, you can search me up on Instagram or TikTok if anyone's on TikTok. And I've got a couple of accounts there, but if you search up my name, so Jake and then Doleschal, so Doleschal, I'm probably going to be the only person who will pop up.
Fantastic. Thanks again, guys.
Thank you,
Thanks,
Tony.
Thanks, Jake.
Thanks for tuning in to the Stronger with Time podcast. If you enjoyed this episode, please consider subscribing or sharing it with someone who could benefit. For more insights and to continue our conversations, you can find me on Instagram. The link is in the show notes. Until then, I'll catch you next week for another episode.